All right, guys, we are live. We have Matthew and Dr. Emer here today.
Hey guys, it's Dr. Emer, and I want to tell you something. 14 years ago, I did some of the initial research on Fraxel, and Fraxel laser is still one of the gold standard treatments for skin rejuvenation, for removal of sun damage, especially in light skin tones, like my patient here today, who's obviously super beautiful. She already did Morpheus treatment, so don't freak out. That's why she's red and a little bloody. And on top, we're gonna do our laser treatment called Fraxel so that we get brightening. So she did tightening and now she's brightening. And we have our nurse Matthew right now is doing Fraxel. Tell them about Fraxel. Why should people do Fraxel?
Yes, Fraxel is a great option. We have 2 wavelengths we can use. This patient's getting a more aggressive treatment today to remove sun damage, reduce fine lines and wrinkles. This is really going to help rejuvenate her skin, and we like to call this the brighten type, one of our more popular procedures, because like Dr. Emer was saying, the Morpheus is tightening and this is brightening. So we're evening out skin tone. We're going to remove some of the sun damage, and right now we're doing the treatment, and she'll scab over the next few days and she'll peel a little bit. She'll be a little swollen. We're gonna follow her journey, kind of see how she does, and really see. She's gonna be using the skincare. She's gonna be using Emerage, Refit Face, the Hyla B, AOXC. It's gonna really help her heal a lot quicker than someone who doesn't use a skincare. It's like Dr. Emer says, skincare is so important.
Exactly. So it's really important. I always tell people every 3 to 4 months you have to do a stronger laser to resurface the skin and get collagen production and increase cell turnover. And increase cell turnover and just brighten the skin. Our patient's light skin tone, so she's at a higher risk for skin cancer. So we want to limit that. We want to limit that risk for her by doing these laser treatments. How does it feel? I know it hurts a little. What do you think?
I'm fine with it.
You're like the strongest woman I know. Seriously. You are seriously.
Well, no, but it's so worth it.
It's worth it.
You
No,
know?
and we're doing a really strong treatment on her right now, you guys. The 1927 wavelength, typically we do about 30 to 45% of coverage. What that means is only 30 or 45% of the skin's actually affected. But what are we doing today? 55%, which is going to give her such a glow in a week. It's going to be crazy. No, you're fine. It's going to be crazy. And we're going to see so much lifting of any sun damage. Wrinkles will improve. And we're just keeping her looking young. We want her to look phenomenal. And so why did you want to do Fraxel? Why do you want to do lasers?
Why do I?
Yeah, like
Well, I mean, one of the big things is skin cancer.
Yeah, we got to prevent it.
And, you know, and the thing is, it's I know a lady who has literally got a melon scooper taken out of her nose.
Oh my God.
And
that's like when I was a skin cancer surgeon, I told you, it's so deforming.
Yeah.
It can cause so much problems for people.
And if you can just do this every 3 or 4 months.
Yeah, and look better.
Yes,
and look better.
Absolutely. I mean,
it's a mix. That was the thing. In the old days, we used to do peels. We used to do, you know, and it really didn't improve long term, and you didn't get as much tightening. Here, we're getting tightening of the skin. We're getting improvement in wrinkles. She's reverse aging, everybody. Reverse aging. That's the thing. You got to reverse age. That's what we want. You got to keep her looking amazing.
Please.
So listen, if you guys listen, you can hear little crackles. Okay, so we're gonna get close. Listen, you hear that little crackling? That's because we're literally right on the surface waters and the surface cells. So dark skin types, it's actually not that great to do this wavelength for them because it's too superficial. It can cause hyperpigmentation. That's why this is not good for melasma. Not at all good for melasma.
We have some questions here for you.
Yeah, what are they saying?
Does this help make pores smaller?
It shrinks the pores like you wouldn't believe. And actually, if you don't want to do something this strong every 3 or 4 months, which is what you should do, you could do lighter treatments like Clear and Brilliant or Moxie to keep it shrunk more regularly. And then, so Matthew, tell everybody what you're doing. Why are you? What do you have to do to make Fraxel successful?
Well, first of all, you have to use skincare to help the healing process.
That's very true. So where can they get a consult with you virtually?
Virtually, they can go to emeraldcosmetics.com, or you can give us a call or DM us.
Perfect.
And when you come in, we'll be able to assess your skin. And Dr. Emer's protocols with skincare is definitely going to help either prep your skin for a treatment or give us an idea of what products you're going to really benefit from pre and post laser.
Well, this is why her skin looks amazing. She
Yes.
follows all the protocols, literally step by step.
Step by step. She has every product that we have.
She does. And we're gonna give her some nude skin today. I'm gonna give her a little nude skin pack.
She is so excited.
I can't wait to give her guys nude skin. If you guys want to learn about nude skin, go to emeraldcosmetics.com. I'm very proud of it because I created it, and it's now at Sephora and Ulta, and it's an amazing product line. What else did you say we were gonna say?
At what age can people start trying this?
I've been doing Fraxel every 4 months since I was 26, you guys.
Oh my God.
Which is why I know.
You look like a bitch.
You
Your
don't
skin looks like a
tell
baby.
anyone my age, okay? You're not allowed to tell anyone my age.
It looks like a baby.
Thank you. Well, I'm told that my skin looks very young. I don't know. Right now I have dark circles because I had lipo this morning. But how's my skin tone look? I do my Aerify and I do Fraxels, and I've been doing lighter lasers like Clear Brilliant and Moxie in between. We'll videotape it at some point in the future. And then
Cosmolon.
and then
How
yeah,
much
and then
does-
peels.
How much does this cost?
Depends on where you go, you guys, and what your treatments you do and how many areas. On average, this could cost a couple, $1,000 to $2,000 a treatment. But it's very low. I mean, especially if you get a skin cancer and you have to cut off half your face, it's not even a question. You should do it.
This is elective, you guys. This is not a medical treatment. This is elective, and you can prevent that from happening, just like Dr. Emer
And
said.
you can help scarring with this. Now the 1550 wavelength does a little bit more for scarring, but for superficial ice pick scars and fine wrinkles, 1927 is great.
Someone's asking us for African American skin tone.
Not this wavelength. You could do a different wavelength, the 1550, but the 1927, no, too superficial. But lighter lasers like Clear Brilliant Moxie, you can, which is amazing. In the old days, we never had any lasers that you could use on dark skin types.
What can you recommend for darker skin types?
So many things. You guys need to do a consult with us because there's peels, there's skincare, there's aerolase, there's microneedling radiofrequency, PRP, the list goes on and on. We could go on forever about treatments for our darker skin types.
Does this help with post-inflammatory
Erythema? No, not really. That needs vascular laser, like BBL or Halo, or BBL or V-beam or XLV.
Dr. Emer, I need to see you, someone said.
Come see us. Appointments at jasonmrmd.com, you guys. So we'll do just a few more minutes. She's doing amazing, by the way, you guys. Amazing. And look at, we're shrinking those pores. Literally, we're gonna shrink those pores. It's very important with this handpiece. It has cold air, which is phenomenal. That helps the treatment. And being very thorough. Nurse Matthew is being very thorough with his treatments, right, Matthew?
Yeah.
What do you tell everybody about doing treatments with you? What are they gonna experience?
Type A personality.
It's good to know. His dating site says personality. No, I'm kidding. That's good. Meticulous.
conversation.
It's very very good conversation.
You are.
We talk about horror movies. No, the important thing, you guys, with lasers is you go to somewhere experienced and you go somewhere meticulous. You don't want to have scratch marks or lines, and you also don't want to get burned.
Is there a numbing cream that we apply beforehand?
Yes, it's very important. And really quickly, I want to do a shout out to our eye goggle company. Turn your head just a little right. Show them to the right.
Oh, pardon, the other
Show
way.
them here this goggle. See Innovative Optics? I actually helped create these goggles, and they're probably the best goggles ever made for laser. Look at this. You can actually turn this like this. So you can actually easily manipulate the laser. So Innovative Optics, if you guys ever want any goggles, I'm gonna do a little shout out. Okay, let Matthew continue.
Okay, turn to your left.
All right, that's really it. What else are they asking? Anything else?
That's it. That's all we got.
So Fraxel for rejuvenation. Do a quick zoom in and then let Matthew continue, and that's it. Doing a great job. All right, you guys, we will continue to follow up with her over the next week. Our goal is to get pictures every day so we can show you a transition of what Fraxel is like after, or a tight and right procedure after a 7 to 10 day period. So stay tuned. Perfect. All right.
Today I'm doing great off